What happens when hepatitis viruses enter liver cells? Imagine a tiny virus sneaking into the liver, a vital organ that filters blood and helps keep us healthy. When hepatitis viruses reach the liver, they don't just pass through. They actively invade liver cells, called hepatocytes, to set up shop and replicate. This process starts with the virus attaching to specific molecules on the surface of the hepatocyte. Different hepatitis viruses have different ways of doing this. For example, hepatitis C virus binds to molecules called glycosaminoglycans and specific receptors like scavenger receptor class B type 1, CD81, claudin 1, and occludin. These receptors act like docking stations that help the virus latch onto the cell. Hepatitis B virus mainly targets a receptor called sodium taurocholate cotransporting polypeptide, or NTCP, which is a transporter involved in bile salt movement. Hepatitis D virus, which needs hepatitis B virus to infect, uses the same NTCP receptor to gain entry into the liver cells. Once attached, the virus is taken inside the cell through a process called endocytosis. Think of it as the cell wrapping around the virus and pulling it inside in a little bubble. For hepatitis C and B viruses, this involves clathrin-coated vesicles, which are like tiny transport trucks that ferry the virus into the cell. The virus then escapes from this vesicle into the cytoplasm, the cell's internal fluid. Hepatitis C virus releases its RNA genetic material directly into the cytoplasm, where it hijacks the cell's machinery to make more copies of itself. Hepatitis B virus, on the other hand, delivers its DNA into the nucleus, the cell's command center. Inside the nucleus, the viral DNA converts into a stable form called covalently closed circular DNA, or cccDNA. This acts as a blueprint for making new viral RNA, which then leaves the nucleus to produce viral proteins and assemble new virus particles. Hepatitis D virus, which is a defective virus, depends on hepatitis B virus's proteins to replicate and spread. As the virus replicates, it can spread from cell to cell. Hepatitis C virus is especially good at moving directly between neighboring hepatocytes, helping it evade the immune system. Over time, this ongoing invasion and replication cause liver inflammation, which can lead to scarring or fibrosis. If the infection persists, it can progress to cirrhosis, where the liver becomes stiff and scarred. Chronic hepatitis infections also significantly increase the risk of developing liver cancer, known as hepatocellular carcinoma. Understanding how hepatitis viruses enter liver cells underscores the importance of prevention. Vaccination against hepatitis B is highly effective and is a key strategy to prevent infection. Avoiding contact with infected blood or bodily fluids, practicing safe injection methods, and using harm reduction strategies are essential to reduce exposure. For those already infected, antiviral medications can help block different stages of the virus's life cycle, including entry into the cell, replication, and spread. Some drugs are designed to interfere with the virus's ability to bind to receptors like NTCP, preventing the virus from entering new cells and reducing liver damage. In summary, hepatitis viruses invade liver cells by attaching to specific receptors, entering through endocytosis, releasing their genetic material, and then replicating inside the cell. This process can cause long-term liver damage, but with proper prevention, vaccination, and medical care, we can significantly reduce the risk of infection and protect liver health. Always consult healthcare professionals for personalized advice and treatment options to keep your liver safe and healthy.